This segment is sponsored by Oklahoma Proton Center. Welcome back to Living Oklahoma. October is Breast Cancer Awareness Month, and we are getting pink here on Fox 25 and Living Oklahoma. Joining us now, decked out in his pink as well, is Dr. Mark Story with the Oklahoma Proton Center. Welcome. Tell us about proton therapy and how it relates to heart health with breast cancer patients.
Yeah, it's an excellent question. It's an exciting time to be here talking about protons and what we can do to help with women's health. I think it's important to point out that as time has gone on, we've done better with the treatment of breast cancer. Today, ladies diagnosed with breast cancer have a 5-year survival of nearly 90%. And as ladies live longer, it's more and more important for us to minimize long-term toxicity. And proton therapy is a special kind of radiation treatment that allows us, for some women, to eliminate or drastically reduce the amount of radiation that's delivered to the heart. And we know that that results in less long-term toxicity and less cardiac side effects.
I know a lot of women are very excited to hear all of that. We understand there are also some clinical trials happening right now in Oklahoma. Tell us more about that.
Absolutely. Myself and Dr. John Cheng, who's my partner at the Oklahoma Proton Center, both feel that it's very important to push the science forward, to do research, help us learn more things so that in the future we can do better with the treatment of breast cancer, so that we can minimize toxicity and improve outcomes. So we have, I think, 2 very important trials. One is for more locally advanced breast cancers, where we have to treat broader areas. And the main point of that trial is to prove that we can really significantly reduce dose to the heart and lungs, and therefore improve long-term outcomes. And then at the other end of the spectrum, we have ladies who have early breast cancer. And for those women, it's really about making it shorter and more convenient, treating just a part of the breast, getting that treatment done in maybe just 10 days. Wow. And so we have 2 trials at the very opposite ends of the spectrum that I think cover a broad population of breast cancer patients, seeing if we can do better.
And what do you mean when you tell patients to be their own advocate?
In simple terms, proton therapy is still not well known. There are only 32 facilities like the facility we have in Oklahoma City here. So it's not usually used for the treatment of many cancers. It's drastically underused. I like to think that it should be used for about 10 to 15% of treatments with breast cancer. It's currently used for about 1 in 500 ladies. So we really encourage you to be an advocate, to go online, to read and learn about the benefits of proton therapy, and then talk to your doctor about simple things like heart dose and heart health. And if you're receiving treatments that have done great as far as survival, like some chemotherapies or Herceptin that can have heart toxicity, is there something else that you can do with the radiation to help reduce that side effect?
So it's really up to every woman to find out what is best for her and to do the research. And if they have any questions, they can always call you and ask, right?
Absolutely. There was a great talk. Joan London was in town on Friday night, and she very simply stated that she encouraged all of the women to be the CEO of their own health.
I love that.
Take charge, be on top of your preventative maintenance, do your mammograms, know your family history, be involved in your health care. As healthcare professionals, we need your help.
Yes.
And caring for you.
Absolutely.
I love that.
Dr. Story, thank you so much. And thanks for coming all decked out. We love it. The pink watch is a real showstopper. Oklahoma Proton Center is located at 901 West Memorial Road in Oklahoma City. You can find them online at okcproton.com or give them a call at 405-773-6700.